Good morning. It is Dr. Jen Martin with Aging Advantage. Today, I would like to introduce all of you to Nikki Mitchell. She is with Mitchell Brown and Associates, and today she's going to be joining us to give you all the educational opportunity to learn more for our family caregivers about Medicaid eligibility and what that looks like regarding home and community-based services for the Medicaid clients. So really important information she's going to share with us, and excited for you guys all to be able to, like I said, learn more and then ask some good questions at the end.
Thanks for having me. So I will just do a quick introduction of myself. So my name is Nikki Mitchell. I am an attorney here in St. Louis at Mitchell Brown and Associates. We are an elder law and special needs planning firm. We have been around since the mid 90s. And have always focused just on elder law and special needs planning. So the kinds of things that I'm going to go over with you today are the things that I have conversations with clients about all the time. Um, and and yeah, I think like this, I'm going to be speaking to you today about a program that is funded by Medicaid that I think it really accomplishes a couple of things. One is that it allows people who want to continue living in the community longer to do that, and to have some assistance doing that. And I think it does sort of open up the availability of certain programs that do help with some of this isolation, right? To get you out into activities, or at least have somebody who's coming to your home who you can visit with and things like that. But it is, to encourage this um, independent, so to speak, living for as long as possible. So I'm going to talk a little bit about the home and community-based services programs that Medicaid funds. I'll just say up front that this program has a lot of intricacies, and just for time purposes, we're going to be doing a very high level overview of this. But I do think that it's a program that provides a lot of services that people could be taking more advantage of. The other thing I think it does is, a lot of times when people come to me and say, like, I have a son or a daughter or somebody who is helping to take care of me, and I would like to be able to keep them do that. Often, if they're going to get paid by Medicaid to do that, the program you have to be eligible for is this home and community-based programs, or it's called HCB is the acronym, just if I start falling into acronyms today, so you guys know what I'm talking about. So HCB is a program that falls under the Medicaid umbrella, so it is funded with Medicaid dollars, and it does have some of the same eligibility requirements as some of the other Medicaid programs, but also a few differences that we'll see today. One thing that another thing I'll note is that there are some additional rules for this program if you are a married person that I'm not going to go into today, just for time purposes. We don't really have time to cover that, but I'll just make note of it so that if you are married, you understand that there'll be some additional considerations to make. And the other thing is that if you are already on Medicaid, this is something you can kind of add into it, depending on the type of Medicaid that you're receiving. So, one of the things people may already know is that in Missouri, Medicaid has somewhere like 20 something, 23, 24 different programs that fall under this umbrella that are funded by Medicaid dollars. And so, and just to keep us on our toes and make it interesting, each one of them has different eligibility requirements that we have to be aware of. So for HCB, the reason why I think it can be so helpful for people is because of the additional services, right? So if you're already on like what I would call community Medicaid, or like card for services Medicaid, you get the health insurance coverage component of Medicaid already. And so you would continue to have that if you were on HCB. In addition to that, though, the types of programs that HCB can cover are things like adult daycare, which has a lot of programming that can get you, out into systems that have activities and provide meals and things like that. Respite care for caregivers who may need, if they have to go on vacation or leave town or just really need a break from things. It also pays for things like incontinence supplies, um, home-based meals, transportation for like to appointments, to adult daycare, things like that. Um, Personal care assistance, which is things like if you need assistance to get dressed or to shower or to um, cook meals and things like that. It will help with that. In addition to like what I would categorize as maybe like homemaker services, right? So doing the dishes, doing laundry, cleaning the house, doing grocery shopping and errands and things like that, right? So lots of things that some people just may need a little help with in order to keep living at home safely. So these are the kinds of services that kind of get built onto this program. There are some very specific requirements to be eligible for this program. One number that you see repeat a lot in the Medicaid eligibility rules is right now 6,068, which is the asset limit for people to be eligible for Medicaid. Another, thing that Medicaid does just to keep us all confused is there are three different times during the year where their eligibility numbers change. This particular one changes on July 1st of every year. So it does increase slightly, usually not by a lot. This is the number that if you have been familiar with Medicaid or been on Medicaid for a while, it used to be under 1,000, right? That $999. You could not have more than that. And then several years ago in Missouri, we started increasing that until it hit 5,000, and now we just raise it every year by inflation. So that does change every July, but not significantly for now. I think if you stick with like this, the idea that $6,000 is the cutoff, that's a pretty safe place to be. And that excludes certain things. There are some things that Medicaid does not count toward that number. One of them being your house, another being a car, and a few other things. But they do count all of your bank accounts, all of your retirement accounts, if you have those savings accounts, investments, all that kind of stuff counts toward the $6,000. So you can't have more than 6,000 in assets to be eligible. And then this particular program does also have an income limit. And so right now, the income limit for the person who's going to be receiving HCB services is $1,737. And that's as of January 1st. And so next year, January 1st, it will go up a little bit as well. There are some, if your income is above that, there are some techniques we can use to plan around that to make you still eligible for the service. There's a special kind of trust that that Missouri Medicaid has approved, and they actually have their own template of it. So you don't even have to recreate the wheel. You just use the form that they have. And your excess income can go into that trust every month to make you eligible. There's some special rules for that I'm not going to get into too much, but for what the money in that trust can be spent on. And so that's something you want to have a conversation with whoever's kind of helping you navigate through this system, to make sure that your budget allows for what the restrictions are going to be for the money that goes into that trust. And so if you meet the asset and the income limit for that, then you can apply for this program. There are well, let me back up before I get into that. One other thing I'll mention is one of the things that is true for this program that is not true for all of the Medicaid programs is that this particular program does have a transfer penalty, which means if you give away assets or sell them for less than fair market value within 5 years of applying for this program, then Medicaid can penalize you. So that transfer penalty rule is not applicable for like community Medicaid, right? That card for services program I mentioned earlier. Technically speaking, if you gave away everything and then applied for it the next day, there'd be no penalty, but that's not true for HCB. And so that's the other thing to keep in mind is if your assets are above that 6,000, you can't just give away the extra to somebody, to manage for you, because then you're not going to be eligible for this program. And the amount of time you're not eligible for the program depends on how much you gave away. So there's a whole formula that goes into calculating that. But otherwise, if you are eligible and we're not going to have to deal with the penalty, then you have to apply for this program. And then when you submit the application, two things are triggered. One is that the financial side of things on the application is sent to a state caseworker to review for eligibility purposes. They'll do their, excuse me, they will do their normal review of the application, and then separately, the case is sent to a special unit who comes out to do the assessment. The reason you have to have an assessment done for this particular program is because you have to require a certain level of care in order to be eligible for all of these extra services, right? You need to require the assistance of someone to actually do the things that I sort of mentioned earlier, in order to be eligible for the program. So this is not really a program for somebody if you're living independently in the community and you don't need any additional help with any of the services. You're capable of kind of getting around and doing things on your own. This isn't a program you're going to be eligible for because you're not going to meet the cutoff for that assessment that gets done. The assessment is based on points. And so when the assessor comes out, just one thing I'll make note of is, I think we naturally, most of us just have a tendency to want to sort of downplay how much assistance we might need for something, right? And just say like, I can do that on my own. This is not a time where you want to do that. If the assessor comes out, you want to be really open and honest with them about any difficulties you have completing some of these tasks. If you downplay that, then you may not get enough points to qualify for the program. And so that is a really important piece of this to keep in mind, because the point system is a very straightforward point system. You either meet the points or you don't. And if you don't, then you don't get the services, right? So you want to be very forthcoming about that stuff. And I would suggest even maybe like if you know that you're submitting this application, sit down and name all of those things, right? Because if you're sitting in front of an assessor and they ask you something that you maybe don't have to do on a regular basis, it's not even going to be on top of your mind, right? All the time it happens to me where I go to my doctor's office and they're like, any other stuff going on? And I probably had like 5 things in my head before that appointment that I wanted to talk to them about, but then I didn't write it down. And so I totally forgot about it. I would say like prepare for the assessment by putting some of that stuff down, all the little things that you might not be thinking about. And it doesn't have to be that you can't do it on your own. It's just that it would be easier to do if you had a little help, right? So if you meet all of the financial eligibility requirements, you pass the assessment, you've got enough points to be eligible for the program, then the assessor sends that back, the caseworker overall approves it. And this is where you're assigned, it's approved, and now we have to have a company who's going to provide the services, right? So the services are provided by private companies who have been approved by Medicaid to provide the services. They've agreed, they have contracts with Medicaid for billing and reimbursement rates and things like that. And so you have some flexibility in being able to choose one of those companies if there's a particular one you want to work with. Otherwise, you're going to be kind of given a list, and if you don't choose somebody, that's just going to be assigned for you. This is the spot where if you do have a family member who would like to be paid to provide those services, you can do it by having them either become an employee of that particular company, and then they will get paid the rate. Sometimes, even though the contracts are very similar, some companies might pay their staff more. So some family members might want to kind of ask around about that so that they're getting the best hourly rate. And then once all of that is all set up, whether you've got a family member or not, if you don't, you'll have just staff of that company assigned to you. Then you will be given a certain number of hours each week that this company is authorized to provide for assistance for you. Um, the maximum that is ever going to be allowed, and this is not what is always approved, but this is that the maximum I've ever seen allowed is 12 hours per day if you needed that much care. I think if you're going to get to that level of care, you're needing help with basically everything, and would also like qualify probably to be in a nursing home or something. Like your level of care is that high if you're getting that many hours. So it's probably going to be something backed off of that a little bit. Um, but they can come several days a week and provide all of these different services that I mentioned at the beginning. So long as you maintain eligibility for that program, then you will keep getting those services every time. I will say that there's a couple of downsides to the program, which are that sometimes getting all of these steps done to get to the point where you're approved and you have a person in place and a company in place that will provide the services can take some time. So this is one of those things where I would say plan ahead. If you're kind of in like crisis mode where you absolutely have to have somebody like now, this is not the program that's going to be great for you. You could be applying for it, but you're going to want to have some sort of like backstop to fill the gap for that. And the other thing that I have seen is that these companies, like many of the direct service providers that we've seen, whether in facilities or in the community, have staffing shortages and staffing problems, just like so many of even the private companies have these days. And so with that comes, people who don't show up or they call out sick and then they don't have anybody who can fill that gap because there's just not enough staff to do it. So usually what I recommend for people is if you are going to be part of this program, have some sort of, like if you absolutely need to have somebody there on any given day, have some sort of plan B if possible. I have lots of clients who come to me and, they need this to be on this program to get all of the assistance, and they have children, but their children work full time or something, right? Like it's hard for them to be there all the time. But I think you still want to have some sort of a plan for when these things happen because they inevitably will, where there would be a day where the staff just isn't there. Also, another thing that I'll kind of point out just as a tip is when you're in the middle of choosing like which company you're going to go with, do some research into that, meet with people, make sure you're comfortable with them. Once you've chosen someone or you've been assigned someone, it's not impossible to change them, but it's not super easy and it definitely takes some time. And so if you have a lot of problems with the company, coming back and trying to get a different assignment and switching could mean you're either using the people you're not very happy with for longer than you want to, or that you have some sort of gap in coverage because now, even though you're still eligible for the program, you haven't quite got to the point where this other new company can, excuse me, provide the care for you. So, so again, that's just a super quick overview of the program. Where I see this be really helpful for clients in my practice is the people who really, really want to continue living at home. They do not want to have to go to a nursing home or something. And this allows them to do that for longer. It also allows a break for the family caregivers, right? Whether that's a spouse or that's children, whoever it is, to have an extra set of hands to do some of the work. One of the things that I see a lot is, especially for spouses, is there's a spouse caregiver who's providing all of this care and their health is going downhill, right? Because the caregiving is so taxing for them that they start to be unwell or they hurt themselves, like just from all the lifting and the physicality of the things that they're doing. And so you can have somebody who comes in and you can say, well, I can do some of this stuff myself and I want to keep doing some of this stuff myself. But you've got another person that you can task with some of these things that aren't as easy for you to do. Even if you don't need them for all of the hours you're approved for, that's still helpful. And then if at some point that this program isn't enough anymore and you need to transition to something else, you're already eligible. You already meet all of the eligibility requirements that you would need to move into some of these other Medicaid programs that would provide more care, most likely being into some sort of a facility. And so the transition later into those programs is much easier because all of the legwork you would have had to do for those programs, you've already done for HCB. So I like HCB a lot for allowing people to stay in the community. It sort of does overlap with some of these other programs that fall under the same section of Medicaid as HCB, things like the community support waiver or the self-directed supports programs and things like that, where you're hiring your own caregivers. Medicaid's just giving you money and saying you hire the people you want for caregiving services. There's some overlap in how those programs work or what your level of care needs to be to happen. The HCP program in particular, I think, is nice because if you don't want or don't really have the capability of being the employer, like with self-directed supports, where you have to go out and find the people to hire and train them and things like that. If that's not something that's really within your wheelhouse, then HCB will get you those same services, but you don't have to do all of the legwork on finding somebody for yourself. You just have this company do it, and then they're the ones in charge of all of that. So, yeah. So that is kind of HCB in a very tight nutshell. And I guess I'll open it up for if anybody's got any questions or anything you want me to go into a little bit more.
Yeah, that was awesome. Thank you. I think one of the things with people that gets so confusing, to your point, is it's just like not knowing the precursors, and the steps that they need to be doing to be able to get them qualified for some of these programs. And so
Yeah.
I love you did a really good job explaining, the different things they need to do to set themselves up, because a lot of times, as you know, unfortunately, doing what you do, so much of what we're all trying to handle is like crisis. Oh no, we have this situation right now, or mom or dad or whoever, like went into the hospital, and what that looked like when they went in is not the same as what it looks
Right.
like when they came out. And so,
Yep.
sometimes you only have like a 1 week, 2 week, 3 week, depending on whatever that gap is when they're in the hospital, to figure out like what that next, like we talk about continuum of care, but like what that next level of care looks like, and to get some of those things coordinated. And so I to your point, like I love it. It's like the families and patients themselves, like at least like if they know, okay, eventually we're going to need to go this route eventually,
Yep.
like whenever that's going to be, the more they
Yep.
can proactively like set this stuff up and get it in motion, the sooner the better. So that there isn't the,
Yes,
last minute drama. Oh no, now what do we do? Scenario. So I love
for
that.
sure.
And yeah, with that being said, like, is there any other things like that you see that you're like people, again, from the like, oh no, crisis moment that you see, for people and opportunities, I guess, for people to be proactive and kind of back up, different aspects of that a little bit more? Like, when can they start handling some of those things?
Yeah.
From
I
a
think
standpoint.
I think it's good for people to start doing some of this planning before they think they really need it. Like so early sometimes that you're like, I'm probably not even going to be eligible yet, but let's sit down and have a plan and have a conversation about what it's going to look like, because um, the the timeline right now for approval of these is not weeks long, it is months long. Just the caseworkers and the caseload that they have for approving these things is so backed up. So you might be looking at 4 or 5 months just for the caseworker to be reviewing the financial side of things right now. That's how backed up things are. And so, you know, and so I think having that plan B that can fill that gap is really important. So even if the conversation is like, we already meet all the eligibility requirements, so when we're ready to do this, we'll just submit the application. I think you still want to say, but because that application is going to take so long to get to the point where we actually have services starting, what are we going to do in the meantime?
Mhm.
Right. So that's the kind of thing I would say people can make a plan for. The other thing I will just make a note of for all of this stuff is kind of not related to Medicaid, but in general, if you haven't looked at like your estate planning documents and don't have like powers of attorney, healthcare power of attorney, and things like that, where your financial power of attorney, right? So that
Mhm.
you've given somebody the authority to sign off on stuff for you if they need to.
Mhm.
Start putting those things in place, because if you get to the point where you're submitting these applications and you're not in a space where you can do that yourself, you need to have somebody who has legal authority to do it on your behalf. And they may need to access lots of documents and stuff they're not going to get access to if they don't have the proper documentation in place. So those are some more advanced things you can be looking at and say, okay, I have all of this in place. I've identified the person who's going to kind of take care of this for me. And then they'll be ready to kind of put this all in motion when it needs to be.
And well, and to your point also, I think a lot of people, families and the clients themselves, etc., don't realize too that, they're like, oh yeah, I have the power of attorney, we're good, we're fine, we're done. And no, as you know, it's
Yeah.
like a lot of times in power of attorney land, um, it's well, there's a lot of times it is like it's the medical power of attorney, right? Because whenever you go through any of the healthcare system stuff, they'll ask you, okay, do you have the power of attorney? And it's like,
Yeah.
oh yes, okay, but that's the medical power of attorney, and that literally only gets you so far. That lets
Right.
you know, okay, I get to decide if we resuscitate you, I get to decide if
Yep.
we pull the plug, whatever, right? Like that does the medical stuff. But
Right.
to your point, like there's the whole entire, also equally important,
Yeah.
financial power of attorney that
For
has to
sure.
happen. And that's like all the bank account stuff and all, it's like who's getting
All
the
of the
title to the
things.
car, all the, the house
Yeah.
stuff, so there's that whole entire other aspect that people don't really think about. Can you speak to that for just a quick second, kind of like what
Hmm.
those two differentiators are for people so that they understand, and kind of what some of those
Yep.
documents kind of would look like that they would
Yeah,
need to
for
kind of
sure.
gather
Um,
together?
Yeah, so the healthcare power of attorney, so what the healthcare power of attorney says is here's the person who gets to make medical decisions for me if I can't. So if you can make medical decisions for yourself, then you're the only person who does it. If you cannot, then whoever you've named in that document gets to do it, whether that's temporary, long-term, whatever the scenario might be. Um, if they are acting on your behalf, their ability to make decisions is pretty broad. And so that can sometimes include things like where are you going to live if it's not safe to live at home? If you're in the hospital and you're going to be discharged, what is that discharge plan going to look like, right? And also covers end of life decisions and all of that stuff. But it does not touch at all on any of the financial piece of things or dealing with your assets. So you might have a healthcare power of attorney in place that does all of the healthcare stuff, but then there's no, if you don't have a financial power of attorney, you don't have anybody who can actually pay for the stuff that your healthcare POA is putting in place, right? Um, the Missouri Bar actually has a free healthcare power of attorney form available to the public at mobar.org. You can go on there, you'll see like a healthcare power of attorney tab. Um, and it is a perfectly good form that anybody can do completely free. It's a fillable PDF. You download it. It does require two witnesses and a notary. So you'll want to make sure that you do that. The witnesses cannot be the people you've named as your agents in the document. So it has to be other people. Um, but that is available to everybody, and I always recommend that everybody have it. And then when you have it, give it to your doctor. If you have a My Chart, upload it in your My Chart. Make sure that people have access to it. And certainly, if you've named people in it, make sure they know they've been named so that if they get a call from a doctor one day, they're not thrown off about what they're being asked to do. And also because you want them to know what your wishes are, right? Like, you don't want them making decisions that they may not have, that might not be what you would otherwise want them to do. So,
Hmm.
um, and then the financial power of attorney, unfortunately, there is not a free form for that like there is for the healthcare one. I'm sorry, the financial power of attorney is meant to do something similar in that it gives whoever you name in that document the ability to do effectively anything you can do with your money or your assets, they can do for you. So they can open and close bank accounts, change beneficiaries, sell real estate, sign contracts, all kinds of stuff. So very powerful document. Also means don't put somebody in there who maybe doesn't do a great job managing their own money or who you don't trust to have access to all of yours.
Hmm.
Um, but once those two things are in place, you would effectively have somebody to do anything that's needed if you require assistance managing your affairs. And so, financial powers of attorney, actually both of these things really are only good during your lifetime. So the moment you pass away, they will stop being effective. So they're not a substitute for planning for what you want to have happen to your things after you've passed away, but they are very helpful during your lifetime for allowing somebody to step in on your behalf. The only options we have if you don't have those documents and you become incapacitated and unable to do things for yourself is to file something with the court to get a guardianship or conservatorship, and that is a much bigger deal. Um, there's a question here for what advice do I have for people who maybe can't afford to go through a lawyer? So um, I'll touch on that just real quick. So first, I would say if you are already on like the community Medicaid, the what everybody sort of thinks as like traditional Medicaid for the health insurance coverage. Um, you have access to case managers. Most people aren't assigned one just right off the bat, but you can ask Medicaid to assign you one who can help you navigate this. Um, Case managers are going to be some are better than others at navigating some of this. They all have a pretty big caseload. So, there's going to be some work in there. The other thing is if you go into um, either call, and just to be honest, if you call Family Support Division's main number for this, the wait times are long. And sometimes they get so long that they just give you the message that says like, the wait times are too long, just call back. So you can't even be on hold. There's also their website, I think, is pretty good with information on stuff. If you don't have a lot of eligibility concerns where we're not trying to like figure out, do the assets meet the rules? Is your income too high and stuff like that? I think you can either go into the office in person, call them, or go onto the website, and you probably could navigate stuff. Just be aware that you'll want to, they ask for a lot of documentation, so you'll want to try to collect that in advance, bank statements and, IDs and all that kind of stuff. But they have very good information. And then, like I said, if you're already on it and you have a case manager, you can ask them to help you navigate getting into this program. Um, there are some like hospital social workers who can help too. Hospital social workers, again, have like a very high caseload. And so sometimes I think some are able to be more helpful than others just based on what that looks like at any given time, but they are a good resource, at least for maybe getting you started down a path, if not walking all the way through it.
Yeah, that's super helpful. Last thing, real like just quick, fast, also too, where are places nowadays that people can go to get these kind of documents notarized? Because there, is just a plethora of options, but some
Mhm.
people aren't familiar with some of the options. And some of them are just really super convenient, but people just
Yeah.
don't think about it, and that becomes like a mental barrier to them. So what would you recommend for that?
Yeah, so almost every bank that I know has notaries on staff, and if you have an account there, they usually don't charge you to even use them. So that would be one spot. Also, the library. So your public library has a notary. I would call them to make sure the person is actually there at the time. They might charge you a small fee, but that is another good resource. I think a lot of like UPS and FedEx stores will have one as well. They will charge you a fee, but they do have notaries there. So there's lots of places you can usually get them. Um, but I would say banks and libraries are the two easiest because, um, people are going to the bank anyways. So go there and get your documents done in the library. Everybody, there are so many locations and they try to be very helpful.
Yeah. And then last quick question that we have is, obviously for the medical power of attorney part of it, like you said, give that, into the my chart, add that into your healthcare systems, give to your doctors, et cetera. So it can be on file there. Is
Yeah.
there anywhere that the financial power of attorney needs to get documented, or does that need to go to the county? Like, is there anywhere that that goes? What happens with that document?
So generally the financial power of attorney is not, there's no central database where those are housed like, you would put with my chart or something. Sometimes some people will record a power of attorney with the county recorder's office, which is the same place where you record your deeds and things like that, but it's not required to be in order to be active. And I think most people don't do that unless we are revoking the power of attorney and we want to do like kind of formal notice that that's happened, because then it becomes public record and people don't want that document to be available just to everybody. So.
Okay, that makes sense. Yeah, because I had heard that before, because some people had said, yeah, you should put it on file. And then other
Mhm.
people have said, whatever you do, no, don't do that, to your point.
Yeah.
Yeah, because
Yeah.
then it is public record. So,
Mhm.
okay, awesome. Is there anything else before we wrap up for you that you want to add that you think would be helpful?
Not for me. Yeah. No.
Yeah. I was like, no, I think you did a great job sharing all your stuff. So just want to thank you for coming on, yeah, and helping kind of educate everybody and sharing with the Aging Advantage crowd all the different information. And like I said, yeah, just helpful. And again, just trying to help these people plan
Hmm.
is three-fourths of the battle sometimes. So anyways, again, thank you, thank you. What are ways that clients or people that might have more questions could get a hold of you and contact with you if they have any other questions or are interested in services you guys provide?
Yeah. So they can call our office. The phone number is 314-962-0186. They'll speak with our client coordinator, whose name is Colleen. She's great. She'll be able to let you know if it's something we can help with and what that looks like and if it's appropriate, and people want to move forward. She is the keeper of my calendar. So she is the person who sets all of the meetings. Yeah.
Okay, wonderful. All right, well, we appreciate it. Thank you.
Thank
And
you.
Thank
we
you for
will
your
let
time.
everyone go.
And
So.
All
we
right. Thanks,
will
guys.